Live from KSAT 12, the Night Beat starts right now.
Vaccines are the way out of this pandemic. So what happens when one of those vaccines is pulled from the front lines, at least for the moment? We begin with those concerns behind the Johnson Johnson vaccine. 6 women getting sick about 6 to 13 days after getting their shot. One of those women dying.
But there's no evidence showing the vaccine caused the condition, but time is needed to find out what went wrong. Until then, the vaccine is on hold, and tonight thousands of vials are sitting in pharmacy and hospital refrigerators across our region, including one pharmacy in Castle Hills.
It's over 450 people that we are going to not be able to take care of if this doesn't get resolved soon.
Legends Pharmacy says the Johnson Johnson vaccine has appealed to many of its customers.
Our long-term care facilities are spread out throughout the state of Texas, as far north as Sherman all the way down to Brownsville. So when you have one individual who's traveling throughout the state giving vaccines, it's easier to administer one dose.
Now Angela DePaulo is scrambling to get the Moderna vaccine as scientists look at whether there's an explanation as to why a small number of people have experienced a rare type of blood clot after receiving the Johnson Johnson vaccine.
It's really going to be trying to figure out whether there's something unusual going on with these viral-based vaccines, whether there's a situation where a unique individual, their immune makeup, if you will, has them making antibodies to the virus backbone of the vaccine that may be interacting with those platelets.
So far, only 6 U.S. cases out of nearly 7 million people who received the shot reported the rare side effect, all women between the ages of 18 and 48.
In these rare people, there seemed to be a kind of antibody that is being produced that's binding to platelets and causing the platelets to clump and also to be cleared.
No more Johnson Johnson shots will be given out until the CDC lifts the pause. Anyone who's received it in the last 3 weeks should look for easy bruising, nosebleeds, swelling of the arms and legs, tiny blood spots in the skin around the injection site. Those with persistent severe headaches should talk to their doctors immediately. With the help of other vaccines, the world is making progress in slowing down COVID deaths. Medical experts hope this isn't a setback.
Those who are waiting for the Johnson Johnson for whatever reason, now they're going to have reason to not want to get vaccinated at all.
And the pharmacy we spoke with today said their Johnson Johnson vials are good until mid-June, so hopefully they can get things worked out before then. Now, tomorrow, the CDC's Advisory Committee on Immunization Practices will meet to review the cases. The FDA will then review those findings. If you have concerns, you can ask your primary care provider for a complete blood count with platelets test to find out if you have a low platelet count.